I want to talk about right now is the crisis in Ontario healthcare that I hope we can solve together. Because of ER overcrowding across our great province today, we have senior citizens whose soiled undergarments are being changed in open hallways. I am not exaggerating. This is what is happening in our great province. We have patients who are on EMS stretchers, who have been seen by the doctor, whose tests and treatments have been ordered. But because they're stuck on an EMS stretcher and there's no room in the ER because of overcrowding, that patient stays. And they stay for hours and hours and hours. And what happens to someone when they're on a paramedic stretcher for hours and hours and hours? And these are true stories. They are rushed into the emergency room when they lose their vital signs. The nurses and physicians do heroic efforts to try and save that patient's life, but that patient is dead. And these are real stories. And these are stories that we don't hear in the news every day, but this is happening in our province.
Hey, family. You know what? This is so true here in Ontario. They like to call it free healthcare because you can go into a doctor and you can see somebody. You just give them your health card and you can get tests done and all of that. And you don't have to worry about paying anything. This is true. But when it comes to the ER, you can sit for hours. The nurse will triage you. And then, as long as your vitals are good, you will sit there and sit and sit and sit. And sometimes you end up leaving and coming back the next day. It's crazy how bad the ER wait times are. But you know what? I can show you better than I can tell you. Take a look at the ER wait times. I just pulled that today in the Niagara Health System. That's Niagara now. Just take a look at this. Welland Hospital, 3.5 hours to see a doctor, 18 people waiting. Then we have St. Catherine's Hospital, 5.5 hours, 42 people waiting. Niagara Falls Hospital, 4.5 hours, 28 people waiting just to see a doctor. Now, these are just average wait times. If an ambulance comes in with a patient, you're bumped up to 5 hours, maybe 6 hours. So, as I said, it is great to be able to see a doctor and know that you don't have to worry. But, when you're sitting there in an ER just waiting and waiting, you're sick, you're in pain, whatever the case may be, and there's one ER doctor working and you have all these people waiting, it's the most disheartening and discouraging experience. Waiting for a specialist is a whole other story. You can be waiting for months. That's why a lot of people go across the border and pay to see an American doctor, because that does take a shorter period of time. So, there are pros and cons in both, but I will certainly say it is great to not have to worry about having a crazy insurance bill when you go to a doctor, but it's still hard when you have to wait. Let me know what you all think about this.